All right, everybody, welcome back to the Honestly Below segment called The Resident Journey, where we talk about how to excel in residency, get used to the nuances of residency. And today is a really key topic that I'm really excited to have one of the, if not the best person to talk to about, and that's regarding how to excel as a cataract surgeon in residency. So I am joined by Dr. Uday Devgan, who is the world famous host of the CataractCoach.com, the biggest eye surgery channel in the world, and we all know it and love it and learn from it. So Dr. Devgan is a former clinical professor at the UCLA, I should say, Jules Stein Institute, where he was a full clinical professor there. He was also the chief of the Olive View Medical Center, part of UCLA as well. So, someone who's been through it all and has been offering so much knowledge out there, I want to thank him. So, Dr. Devgan, thank you so much for joining, and I cannot wait to learn from you.
Oh, my pleasure. Thanks for having me. I'm a big fan of yours too. And I want to tell you that I love teaching residents. I did it for 22 years. 8 residents a year. So, gosh, coming on a little shy of, let's say 200 residents or 160, 170 residents. So a lot of residents. And I think it's such an incredible time in your life because you're finally learning this amazing new skill set that you're going to enjoy for the next 40 or 50 years.
Absolutely. So I really want to start right here. If I had you, and I've had the pleasure of meeting you in person, and I was just thinking, I was like, what would I want, our audience to know about things that I'd love to just like pick your brain more on. And I really want to start by just asking you this main question. So what are your top few tips? We'll say as many tips as you can provide us, but your top few tips for residents from excelling from those first 10 cases of their, beginning cataract surgery steps to maybe like the next 200 cases. I mean, in between, that's a huge gap, right? So what are the best tips to kind of excel between those two, endpoints, I would say? I mean, you never stop learning, obviously, as you say, but between those 2 points from case 10 to case 200, what's the best way to really maximize your potential and be the best surgeon you can be while a resident?
Well, the first thing you have to do is fix your mindset. You got to understand the purpose of residency is not the diploma. In fact, I don't even have mine up on the walls. The purpose is to squeeze every drop of knowledge and experience and how-to and hands-on that you can during that brief 4-year period. That's the most important goal. And in that regard, when you operate, every case should be a step towards betterment. So if you do 10 cases and you don't record them and you don't go back and watch them and you don't go analyze them, are you really learning from every case? Sometimes we get caught up in numbers. You say, well, if you come and train at UCLA, you do 300 cataracts. You can go to Utah, you'll do 400 cataracts. Can I tell you a secret? 150 cataracts, 300 cataracts, 450 cataracts. It's all about the same. It doesn't really matter. Because anything less than 500, you're still absolutely a newbie. And you are still going to learn a tremendous amount, even up to case 1,000. At best, case 1,000, it's 80% up the learning curve. So cataracts is a really tough learning curve. So the key is every single case you do, at the end of the case, okay, self-critical, be your own toughest critic. Write it down. What did I do well this case? What really did I do poorly? What was okay but needs improvement? What were the pearls I learned? What was kind of the take home here? What did I realize? And you have to do this for every single case you do. Crazy as it sounds, tens of thousands of cases later, I still record my surgeries and watch them. Now, I'll record them on the same memory stick. And, if it was a routine, I may not go back and watch it, but I'll go back and be a little self-critical now. And I finished residency in 2000, 23 years ago. So that's probably the most important thing is what do you get out of every case? The second thing is probably even another incredibly important thing that we can do much easier now than you could before. It was like Socrates says, smart people can learn from others, right? So Socrates says, smart people learn from others. Average people learn from their own experiences. And truly stupid people, they already have all the answers. So first, understand that you know nothing. But yeah, you have to have the appropriate mindset. Say, okay, you know what? I need to get better and better every single case. And I got to put that effort in there. And I think if you do this, you're going to become a much better surgeon. So I record every case that I do now. I may not save them all, and I'll go back and watch it, and I'll ask myself, be self-critical. What could I have done better? I still do that today.
Wow.
So you definitely got to do that. Here's the fun thing. what I do today in the operating room, I did not learn in residency. And the way you will operate, Bilal, in 10 years is not the way you're doing it now.
Hmm.
So you have to espouse the idea that, yeah, I'm a perpetual lifelong student and I'm going to learn from my surgeries and other surgeries and keep doing this in the entirety of my career. When I finished residency, things didn't exist. There's no femtosecond laser. You don't have EDOF lenses. You barely had a multifocal lens, which isn't even that good. It was a wholly different design. You didn't have lamellar transplantation of the cornea. You didn't have anti-VEGF agents. You didn't have an OCT machine.
Yeah.
So all these things keep coming. And you know what's coming in the future? Stuff you don't even know about now. And so
Right.
you've got to learn this. And then the last thing I was saying earlier, that I used to learn from others by videos.
Mm-hmm.
The godfather of cataract surgical videos is Bobby Osher.
Mm-hmm.
Love that man. He was my podcast guest number one on the
Yeah,
Cataract
as
Coach
well.
podcast. Amazing man. When I was a resident, we had to hunt for VHS tapes. This is before DVD. These are like plastic magnetic tapes in low def. And I had to borrow them so I could go and watch them and study them. Because if I can learn from someone else's surgery, I can shorten my learning curve. Well, gosh, now you got your phone here. You have high def videos anywhere on the planet. And you can see a surgical issue and learn that pearl before it happens to you. Great example is phaco wound burns. I had a resident here, a US resident, who said, I saw that smoke sign or the phaco tip. And I remembered, I saw the video. That's a clogged phaco tip. I'm going to get a wound burn. Came out of the eye, flushed it. Sure enough, that was the issue. And we prevented a phaco wound burn. So watching my video gave that surgeon, that resident surgeon, the ability to help his patient and avoid a big complication.
Awesome. And it really sounds like, I mean, it's one thing as a novice resident, beginning cataract surgeon, to watch a video that you did yourself as a resident and say, okay, well, this is my case and took however long, and here's what I'm doing here, and here's what I'm doing here. But to be able to critically analyze and say, well, I could do this step better and this step better, right? I mean, to be able to critically analyze your own surgical video, it takes an understanding of what a good surgical video looks like. And that's what
Right.
your content provides, right? So it seems like building that context of watching enough of what a good surgeon does, or maybe other mistakes other people have made, which you provide on your website, it helps the beginning surgeon at least understand, like, this could be smoother, this could be better, I did this wrong. Is that kind of how you say as well?
Absolutely. You want to soak it up as like a sponge, learn as much as you can. And then again, yeah, you've got to be able to understand what's a beautiful surgery.
Right.
And so we show on Cataract Coach everything. Now, I know people love to watch it only on YouTube, but if you actually go to the website itself, you may be surprised to find a lot more information. First, it's super easily categorized. You can watch just pseudo exfoliation videos, just post-RK radiokeratotomy videos, just posterior polar videos. They're all organized. You can also have a 25-part full curriculum series.
Right.
And it's just shocking that other people don't even realize this. Do it. There's a free PDF Cataract Coach book.
Mm-hmm.
You can download it on your phone. There's no copyright. It's totally free. Send it to your friends. And so you've got to put the effort in. The other thing is you got to also put in the hand-eye coordination.
Mm-hmm.
And we've come this far because we're great at taking tests. You can give me a stack of material. I can memorize it. I can understand it. I can regurgitate it back. I can pass the test. I can score 90th percentile or above easily without even thinking. But that's different than what we're doing now.
Mm-hmm.
This is now hand-eye coordination. Are you going to put the effort in? And there are differences. Let's be straight here. There are differences in abilities. But I'll give you an example. If you said, okay, I'll give you $1 million, you can sink 20 basketball free throws in a row. Now, I'm not that good at sinking basketball free throws, but I would practice like a crazy man.
Sure.
So even if you had someone who already was pretty damn good at it, maybe they wouldn't have to practice for a couple of weeks. Maybe I'd have to do a few months or 6 months, but I could still achieve the outcome. So no matter where you start on that learning curve, and okay, Mom, not so good at doing it, just make it to the end point. For example, I'll give a good example is, if you're a resident, you should be able to do what I call the Devgan 10-10-10. 10 sutures of 10 nylon in 10 minutes. Under a microscope, in the wet lab, on a tomato, on a grape, on whatever it is. Show me. If you can't, then you need to put in the effort to make that happen. And not that you suture all the time in surgery, but it teaches you how to use your hands in a precise manner under a microscope. And the bonus question to that is, with a regular single 10-0 double-ended suture, cut in half, how many total knots can you tie with that much suture and while not dulling the needle? That's the bonus one we don't talk about too often, but
Yeah, I
you,
never
you
heard that.
10, 10, 10, you can do that one. You can say, how much can I do? And then also get that left hand dexterity up. When I attended residents, I'd sit at the head of the bed. Our residents operating temporally. I'm never getting up. So if they're doing a left eye and they're sitting temporally and I'm sitting at the head of the bed, I'll use my left hand and complete their case through the side scope.
Right.
If it's a right eye, I'll use my right hand.
Mhm.
You got to be able to do both. One of my favorite things is having lunch with the residents. And when I have lunch with them, I'd say, look around the table, who's eating with the non-dominant hand? You better brush your teeth, non-dominant hand. If you brush your teeth with your non-dominant hand and it feels weird, that's telling you need to improve those skills.
That's humbling, super humbling. Well,
Right.
actually, and that's really what I wanted to bring up too. I mean, we try to do as much simulation here as we can, and I know you've echoed that in terms of on your website too about really getting under those scopes and using the semis and suturing. And when you sometimes you talk with other residents, they say, well, why would I suture? There's IC, and I could just do the steps of cataract surgery on the IC. I mean, there's suturing versus IC. I mean, what's there? We have newer things now that can maybe simulate surgery better, but you're really still strong on suturing. I know other attendings, some of our attendings here are pretty big on suturing too, for the same thing that you're kind of mentioning, just the kinetics of getting the hand-eye coordination and stuff like that. But
one of the very first programs in the country to get an IC was UCLA. And a lot of the published IC ophthalmology peer-reviewed journal articles of how the IC can benefit came out of UCLA. But I assure you, it's no substitute. IC is to surgery as playing Grand Theft Auto is to actually driving a car.
So, and then going from there, I mean, that's maybe the beginning stages of cataract surgery. And say you're working with chief residents, patients, residents who are about to go out to practice or fellowship or what have you. And they're towards the tail end of their, their graduation timeline and stuff like that. But feedback's still important, then maybe the most important at that time, right? So what's kind of the Dr. Uday Devgan form of feedback? What's your way of really implementing, motivating residents to be like, hey, these are where you're great, these are where you're not so great, and this is what you really need to work on. What's your method for going about giving feedback, and what do you think some areas today residents maybe could do better about receiving feedback?
You got to be open to constructive criticism. Understand, if I'm attending you, I'm literally doing it as a favor to you. Really, I could be doing something far more lucrative in my private clinic as opposed to attending a resident at a county hospital or VA hospital.
Sure.
That's not why you're doing it. So anything I tell you has only one goal: to make you into a better surgeon. My goal is not to break you down and crush you. No. If I attended you as a resident and you do great things in your career, I'm the most proud ever. I'm blown away. The better you do in your career, in your life, and your surgical skills, the better your skills are, the better it makes me look. Mm-hmm. So that's the only goal. So you got to let go of that. And I can't beat around the bush. I can't say I just telling you like it is. So for senior residents in general, once they've kind of gotten past a certain part of the learning curve, I will just sit at the side scope, unscrubbed. But I'm going to give you feedback throughout the case. Mm. And you gotta understand that my purpose is not to break you down or criticize you, but to just get you honed in. Okay, you make I said, I don't like your paracentesis. It's too short. It's too much in the cornea. Or look, you hit the con. It's gonna get ballooned up. You're gonna get chemosis now. Or that incision, the incision seems short to me. So I'm gonna tell you absolutely. You want feedback? It's gonna be real time as you operate. Yeah. I'm not gonna save it for the end of the case and say, here are my top 3 things you could do. No. I'm gonna tell you every step. Yeah. Nope. And I'll tell you, sometimes you don't know what your other hand is doing. Your left hand is depressing the para. You're not floating in the incision. You're not pivoting enough. You're wrinkling the cornea. I'm going to tell you as it happens.
Love that. So, yeah. I think there's some attendings who are totally that way. And I think that's something that maybe for me, I didn't realize that. This is the feedback. It's happening while we're doing the surgery. This is the feedback that it took me a bit to kind of figure that out. This are things I need to, as soon as the case is over, go to my phone, write that stuff down, But I love that.
It's the opposite of what you think. You would think if I'm a good senior, you could just sit there, let me just do the case. Yeah. If I say nothing or almost nothing during your case, that only hurts you. Yeah. Because remember, every case has to be on that path to betterment, to being better and better. If I don't give you any feedback in that case, well, how are you going to get better? You're going to do anything. I think I did a good job. Right. Remember too, to be I would love to have a coach. Come coach me. Even the best tennis players in the world have coaches who they can beat at tennis. The coach, Federer can beat his coach every day of the week. He has a coach. The coach can say, no, let me tell you, here's what you need to be doing better.
I mean, as a lifelong Federer fan myself, that's the point I probably need to think about more too. Love it. So, those are really great points. And I'm just, I'm so glad I could spend this time with you even virtually. But I really want to know if you were talking to, Uday Devgan, first year resident ophthalmology, just trying getting his feet wet and all of this. What's the best advice you would give yourself looking at your whole career now or learning from others too? What would you tell yourself going back into that time machine saying, hey, if you do this, you're going to make your life so much easier? What are some tips you would give yourself?
Don't waste a single day. Residency is such a brief period of time. Every day, if you're a first year resident, let's say you're that PGY1 who's doing the 3 months of ophthalmology that year, and you're like, you barely spell ophthalmology, barely know how to turn the slit lamp, right? Well, you need to do a procedure every day. Now, maybe you're lucky in the clinic, you can do a YAG capsulotomy today. Maybe you'll get to do a suture removal from the cornea. Maybe it's a foreign body removal. You know what? If it's 4:45 p.m. and you haven't done a procedure that day, you best get that gonium mirror out because someone needs their angles checked. You gotta use your hands every day. Don't waste a day like, well, I didn't do any procedures today. You couldn't have done a gonioscopy. You could have done a scleral depressed exam. Sure, you could have. And there's no downside to it. So I think that's a really important thing, to keep your hands wet. You gotta use your hands every single day.
I think within, this 20 minutes of this conversation, you gave a whole list of things that a lot of people are going to learn from. So, Dr. Devgan, I am just so grateful for everything you've done and all the dedication you've given to your career, to teaching others and helping people grow. And I'm sure thousands around the world are better because of you. And so I really appreciate taking the time to do this. It means a lot to me. I think it's going to mean a lot to other people too. And I want to really thank you so much and hope we continue to see and learn from you for many, many years.
My pleasure. Good to be on this podcast. And listen, one day, one of you young ophthalmologists is going to do my phaco. I have to make sure you're really good.
Good point. Good point. Someone will be there. I'm not sure if it's going to be me. I don't know if it'll be me, but someone will be there, I'm sure. But thanks so much again. And looking forward to meeting you again down the road.
All right. Thank you.